it's very, very important that the public is involved at every single stage of the pandemic. From the moment we hear about the first case, what's the best way to involve the public, to communicate it with? How are they going to receive it?
Can you blame people for having trust issues? Because, promises were being made. And I think one thing is when you really engage with the public, like explain, this is an unpredictable virus. This is what we're doing. This is why we're doing it.
Oh, God, the terrorism money is there, but when it's money for PPE.
Please, the virus could be a terrorist too.
Hello, Globies. Welcome to the World Health Investigation Podcast. My name is Jocelyn.
I'm Edna.
And I'm Loza.
We're three young global health professionals and your hosts for the World Health Investigation Podcast.
Also known as the WHI, and we'll be discussing all things global health and unpacking the most controversial health and social issues,
as well as promoting new age global health development and equity.
So, ladies, what is the T in global health today?
Extra with it today.
Yes, taking her time.
What's the T?
Yes.
What is the T?
The T is we are both joining from London.
Live from London.
Without me. Come see graduates. First of all, I just want to say congratulations.
Dina graduated.
Everybody congratulate them.
Congratulations.
Almost a year later,
Pandemic couldn't stop you.
Panoramic.
Panasonic.
But yeah, I feel officially graduated now. Like I can say I'm a graduate.
You feel like you're graduate.
I can say it with my chest now.
Wow. It feels official.
It feels official.
UCL has tied the knot.
Yes.
Firmed it officially with you.
Okay, you need to say it that way.
A marriage, what?
You need to say it that way. Like it's not that deep. It's not it's weird. It's not that deep.
They said you're gonna have a long-term relationship with them as an alumni, so
yeah, that's all great and fine. As long as I still get my career services.
As long as you do.
Yeah.
Anyways, what's the real tea?
The real tea? I mean, listen, this graduation has been delayed for a long time, as you know, because of the pandemic.
Can I say I'm tired?
I'm sick.
I'm sick about COVID.
It's sick and tired.
Mercy.
But we must recognize that we need to reflect upon what happened in this pandemic. Like, what lessons can we actually learn? Because we cannot continue to go back and forth.
We can't do this again.
You really want us to talk about this again?
Yes, again and again and again.
Until we learn.
First it was mental health. Then it was like this pandemic. We have accepted it. It has finished us. It has killed us. Now let's move on.
No, that will not work. We got into this situation because we continue to have that mindset of like, well, the pandemic happened, now it's in the past. Let's get back to normal. And then we're not prepared for the next one.
Fine.
So yes, ladies and gentlemen, today we're talking about like top lessons from the pandemic. Like what can we learn? What are some lessons learned in this pandemic?
There's a lot.
There's a lot that can be said. A lot went wrong. In some places, a lot went right. So we'll discuss about that too.
Yeah.
But before we even get into that, I wanted to just ask you guys, let's begin at the level of like you personally. Did you feel like you were actually prepared for a pandemic? Like when that news broke, would you say, I felt prepared for a pandemic?
Oh yes, I had my helmet on.
I was just gonna say I had my mask ready.
I had my mask ready.
I had 3 packs. No, I saw it coming, obviously, because me and that's so Raven.
I can read the future.
Now, obviously, you guys have studied biomedicine, virology. We've all studied that, so we have an idea of like, yes, pandemics can just come. Zoonosis, diseases can just jump from animals to humans all the time. We're aware of these things.
Yeah.
But still, did you think you like in your lifetime you'd see a pandemic?
No, honestly, no. Let me not even cap. No, at first when I heard COVID, I said it's like the flu. Not to say that the flu is not important, but we had this, I don't know, I saw it on social media channels as well, because we barely knew anything about it. We just heard flu-like symptoms. So I'm like, flu-like symptoms are not that bad. You get small runny nose, small cough. And then for a few days, a little bit of fever just to spice things up. Yeah. And that's about it, you know?
Yeah, we thought it was small,
easy peasy.
Yeah, mild symptoms. I'm like, I'm not gonna die from it. So it's calm. Yeah. Little did I know Miss Rona is an RNA virus, and she replicates really fast. Yeah. She replicates really, really fast. And she got everywhere. And I remember like my lecturers were like, oh, we are very concerned. It's going to affect the entire world. We're all going to, some were like, no, we're not. It's not going to be a problem. We've got it under control. We've dealt with things before. We've just had Ebola. This was when Ebola had just, I think there was a global, there was an Ebola epidemic in 2019, just an outbreak, well. And there was an outbreak. So like, I mean, we've dealt with worse. So small flu will not disturb us. Whereas others were like, no, this replicates really fast. It's not like the flu. It's different. So they were different. They were opposing opinions, very, very opposing opinions. And then people were like, oh, in Africa as well. They're gonna be suffering.
Yeah, they said we're gonna die. They said we're gonna die.
Yeah, there'll be
devastation. The millions of deaths we will see.
Don't worry about us.
Foaming at the mouth.
About Africa. So that was my initial outlook. I was more concerned about why people were just pointing fingers at Africa. That was my concern. I wasn't necessarily prepared. I was more of like, but why?
Yeah. Yeah.
I was just why. That was just my outlook. That's funny. What about you, Lucy?
Yes or no. Like I maybe it's me feeling like the main character, but I felt in my life I would experience a pandemic only because of, and y'all, please don't blame me for this. I didn't bring this on. I know. Okay, I didn't think it would be this bad, but why I thought it is because I remember I used to watch lectures and I used to like study because I like viruses. I used to study it, and people would always say it's very likely we will have an airborne virus that will cause a pandemic. It was repeated all the time. So for me, it was like, it's only a matter of time. It's probably gonna happen. I always assumed it would be an influenza virus. I thought we'd just get another flu. I didn't think it would be Miss Corona that would come for us. But then when it actually hit and we were hearing about this new coronavirus, I didn't take it seriously. I said, why are people stressed? I would even see people like at the gym with like gloves and stuff, and I would be like,
they do the most.
I'm like, guys, I said, it's not Ebola, like relax, it's not that deep. Because the way I saw it too, I had just learned about MERS and SARS. And so to me, I was like, okay, it's MERS and SARS part 3. And the previous two, they had like outbreaks, but they didn't cause a full-blown pandemic. So I thought they would just die out. I thought this one would also die out. My lecturers also did not take it seriously. They said, y'all be fine. School isn't going to close. Everything will be fine. No, it was just like, wash your hands. Everything will be okay. So when it actually hit and the WHO declared it a pandemic, and then the next week everything was shut, and then we were in lockdown, and it was all happening. I was like, whoa.
It went on a skew in 2 seconds.
In 2 seconds. One night I was at your birthday, Jocelyn. The next week I was at home in lockdown for the next 2 years of my life. So
no. And I remember at that time as well, I was revising for my biology exam, and I was reading that they identified a SARS-CoV-2 strain in 2013. And someone there were speculations that there would be an airborne pandemic happening caused
by the coronavirus.
They identified, and it's so, I don't know, it's a bit concerning how it was 95% similar to the SARS-CoV-2 that we have today. That was a bit shocking.
No, I feel exactly the same way as you all. Like, Loz, I love what you brought up about like the lockdowns and how quickly things just like went from 0 to 100. Because I was also feeling like, okay, new infectious disease. Okay, let's see how it goes. Let's not be too worried. Flu happens every year, so I won't be too concerned yet. I think I was on the side of the scientists where I was like, okay, I wouldn't like raise alarms too much yet.
But
then I would never say, even though I was aware of like the virology and that it's an RNA virus and what we can expect and the variants and the mutations, I would never say I was prepared to be in lockdowns. I would never say I was prepared to be wearing masks everywhere. That's the part I would say I was like, whoa, we're actually in a
pandemic. We're actually,
and
we're
by
actually
the way,
living it.
Globies, for those who don't know, an RNA virus is
thank you.
It's a ribonucleic acid virus, so it doesn't have two strands, and let's just say it replicates a lot faster than
so it doesn't have, like, you know how we have DNA, we have two strands of genetic like material, they have one, so they're even quicker at replicating that one that they have.
They're quicker at replicating, and they don't have like the same sort of proofing mechanism that we as humans have. Like, you know, our DNA replicates as well, our cells replicate, but then we have some sort of like, you know, proofing mechanism
to make sure everything is okay.
Yeah, exactly, and it's copied the right way, and there's no mutations and mistakes, shall we say. But then with RNA viruses, for example, they're replicating very fast, number one. Number two, they don't have that fact-checking mechanism necessarily, so
they just go.
They just go,
and you know, and that's why we have the variants. Because they just be replicating, free flow, remixing, mutation,
creating all kinds of
Delta variants. We have Omarion, we have everybody, you know?
Exactly. Like, even right now, like, I don't even know, there's like hundreds of strains of like COVID that we have right now. Like, it's not just the big ones, the Deltas, Omarion, Omicron.
I call it Omarion now. I don't call it
Omicron. Man, Omicron, like, these are the main ones, the ones of concern, but there's hundreds out there. But but okay, then to just like move on from that, personally, you guys, no one prepared for this pandemic. I think that's fine, that's cool, that's fair. But do you expect your government, wherever your government, whether Switzerland, UK, to be prepared for the pandemic? Are you like, okay, me personally, I may not be prepared, but my government should be prepared?
Oh, yes.
Yes.
You had a campaign. You are elected as a leader. You are supposed to protect your people.
Okay.
So preparedness, it is your duty
to lead. And it's true.
Wait, sorry, Lizzie, cut off for a little bit there for us.
Oh Lord, I just said, what are you doing to me? We're just gonna edit it out.
What are you doing?
So what are you doing to
lead? It is your duty.
It is your duty.
That's it.
Okay. Yeah, no, 100%. I'm glad, okay, we're all on the same page here. Okay, we're not saying pandemic preparedness is for all of us here.
Well, I mean, as a normal, as a scientist, maybe, but as a normal person, if I'm here, I decide to I'm a construction worker, why should I be prepared?
As it like, no, but what am I gonna do? Like, how can I even be prepared?
How can I even prepare if I wanted to?
Exactly. Right? Exactly. Is there really a way for us to prepare for an outbreak of any kind? Not really. We don't have control over diseases. We cannot dictate when spillover events happen. And so that's when, you know, diseases can jump from animals to humans. We have no control over that. But what we can control is, you know, we can do some damage control. We can at least prepare to prevent, you know, large scale deaths and all these different things. A pandemic, a panoramic. And so, like, okay, now we're just going other places.
You've unlocked a new one.
So yeah, like one of you mentioned, even before COVID, where we knew of coronaviruses, scientists were aware of this. There was the famous Bill Gates talk where he said, I have the quote here, if anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. I mean, there's war happening now in Ukraine, but
that's not. I'm not on somewhere that happened at the same time, but anyways, that's
a different thing right there. So yeah, again, it is that question of like, okay, we knew all of these things as scientists, as a government, you are aware of all these different things, but why are you still not prepared for a pandemic? And so I thought we would do an exercise just to put ourselves in the mindset of maybe people who have to make these decisions. So I like us to imagine, okay, let's say you were the Minister of Health in your respective country.
Let's go.
Ethiopia.
I'm a politician.
You know, Jocelyn, you are Cameroon.
Please, I don't want that job.
And today, y'all, I'm Zimbabwean. None of you ever take that away from me. But today, I will be Minister of Health for Switzerland.
Oh,
I'm
you
put that upon yourself.
Upon yourself. If I call you Swiss now, you have to say yes.
Yes, I am. You better start singing the national anthem.
They are Swiss.
And I'm just saying them. That's going to be you.
Voila. There we go. Okay,
we're
so
done.
now just imagine the scenario, or you've been given the breakdown of like, there's these cases of this infectious disease, airborne, we think, coming from Wuhan in China. You've been given the breakdown or the phone call, whatever, of the whole situation. Like, what would be like your top worry? Like, what's one of the first things you'd be worried about? Like, or one of the first few things you're worried about when you're told that there's this new infectious disease coming out?
When you tell me infectious disease, I had this virology teacher called Richard Mill. Shout out to Richard Mill.
Shout out to Richard.
He said transmission, and I say transmission. My first concern is transmission, especially with an RNA virus. So if I hear that is it a pandemic already, or we just heard about cases?
We're hearing about cases, potentially a pandemic. We don't know.
We're hearing about cases. So the first thing I'd want to do is stop transmission. And that would be, in this case, because it's COVID and it's a respiratory virus, self-isolating the cases, not on that downplaying it as we did. I think the countries that have done very well and that have managed to contain the virus very effectively are people that were are countries that had a very rapid response. So I think in this case, I would prioritize making sure that they're self-isolating and that we're taking not lockdown originally, but restrictions, like social restrictions, social distancing and stuff like that.
Okay, that's a great point, because I think that's already pointing to the first thing you need to be considering in pandemic preparedness, which is like understand the virus itself, understand the epidemiology of the dynamics of the disease, so that you can make a very well informed policy decision on what restrictions to advise for people.
And just to add on to that, knowing my country, Cameroon, we don't have the capacity for that, big man. We don't have the capacity for we don't have the healthcare burden is already quite a lot, and the public health system, we are trying our very, very best. Okay, so I wouldn't want it to grow. I wouldn't want it to spread. I wouldn't want that dissemination going on. So prioritizing prevention as much as possible, and as much stakeholder involvements. Like, there are different charities, there are non-governmental organizations that are involved as well. So I'll get different stakeholders, not just within public health, but the healthcare sector and social sector as well, to get everyone involved coming together ASAP to have that unanimous standpoint.
Come and see Minister of Health.
You know what I mean?
Please, where are you? And this is why ministers of health, I believe, should be people with health backgrounds, because these Matt Hancock and them, I swear they didn't. Sorry. Okay, sorry, just kidding. But I'm sorry, but like, you're able to be like, this is this kind of virus, this is how I expect it to replicate. You're able to even speak to the scientists, understand where they're coming from, and make recommendations. Some of these people are coming from finance and everything. They don't know.
And they're getting random advice.
And they give random advice and they don't understand.
They don't understand it.
That's why I'm an advocate. If you're a minister of health, please have health backgrounds.
No, I think you guys also pointing out to like a key issue here that we were seeing with the pandemic is a lot of scientists, a lot of people who are like epidemiologists, doctors, who understand the science. Like, I think the key person there is like Anthony Fauci, for example.
Fighting for his life, that man.
Fighting for his life all the time, because it is like, there is the science, there's all of this political stuff that comes with it. And it's like, the scientists are considering like the virus itself, the dynamics, but we have some politicians who are like, okay, what is this going to mean for the economy? Like, I can't just have people sitting at home.
Exactly.
So there's always that battle that was going on between like the science, what the science wants, versus like the policy, the political side of it all. So that was already a key challenge, I would say.
The politician wants to make the people happy. The scientist is going to give
that's their job.
You should. So exactly. They're conflicting it for
that's where the conflict is, and it is easier to it's easier to say solve it than actually applying it in real life, to be honest.
Exactly.
And I think that is, if it was me that was Minister of Health of Ethiopia, if I heard this, first of all, I would leave. I'd say I'm retiring. I'd say I'd say good luck, stay safe, bye. No, but for real, I think
you say like Theresa May.
Today we're not okay.
We're not okay. We don't care anymore. We're just coming for anybody. We're acting people.
No, please, this is not personal.
This is not personal. This is
so purely for banter purposes.
Yes, we're just making a joke.
Yeah, a joke.
But you guys' jobs are hard. No, but for real, for Ethiopia, like I would be concerned on top of like understanding the spreading. I wouldn't, obviously there's already a high burden of infections in Ethiopia. I don't want a new one to be added. But for me also is social security. So if I'm thinking about a pandemic, I know there might be lockdowns eventually, there might be restrictions on people's work, and there's a really high informal sector in Ethiopia. So I would think like, okay, how am I going to protect these people if their livelihoods are also going to be affected by pandemic restrictions? How am I going to give them, how am I going to access them and provide them with some kind of like security so that they don't go out and, you know, increase transmissions and risk their lives? On top of probably like in the early times before, because, you know, at the beginning, people didn't understand exactly how COVID spread or exactly like how deadly it was. So I would also be very strict on like testing and contact tracing anybody that traveled to that country. I think that would be where a lot of my attention would be.
Yes, I agree with you. I think with testing as well, it goes down to the transmission bit, like tracking transmission stopping transmission as much as possible. And the most effective way to do that is to get people tested and having effective tests as well with high sensitivity and specificity. So sensitivity being the number of false positives and what's the
you know, I'm not gonna I always
and I was talking about it yesterday too.
But like sensitivity is false positives and specificity is false negatives.
You want the test to be specific enough to detect like the correct antigens and you want it to be sensitive enough so that it doesn't miss any potential positives.
You want it to be sensitive enough to not miss out on any positive case.
Yes.
And specific enough to not
falsely diagnose.
Falsely diagnose people. There we go. We say ourselves. Those prioritizing that in very, very early stages, because at the moment, because I remember when we heard about COVID, SARS-CoV-2, we just knew that it was it was a pneumonia unknown with unknown acute. I think it was initially early stage. It was called pneumonia with unknown etiology. That's all we knew.
Before they even knew what virus it was.
We didn't know what virus it was, didn't know anything. So the first thing is get the PCRs, get the testing done, and preventing that transmission. If that gets done very well at the beginning, at the early stages, then we won't have to get to later stages of the healthcare burden, the health supplier, the PPE, all those different things.
Right. We could have been saved a pandemic if all of this was done early, but
exactly,
it's difficult.
But Lola, what I do like about like one thing that you mentioned was like the social security, because it is like yes, you're Minister of Health and this is a public health emergency, but you cannot ignore the fact that, you know, you have to consider like the economic impact. What is, like, even for like on an individual level, like down to a household, like, okay, what does this mean for people where there's only one person in the household who works and now we're telling all of them to like
stay home.
Work at home. Do they have internet to be working at home? Is that good for everyone? It's not.
Like, you're telling people to starve to death. If they don't comply, you can't blame them.
It's like I can't go out. Everything. Like, I gotta stay at home alone. Like, I have to feed my 4 children. How am I gonna do that?
How am I gonna do that? Exactly. So yeah, I love both of yours answers. The only thing I would add, okay, like now if I come in from like a Switzerland perspective,
she said, high-income country, high resource setting.
Obviously, if it was me personally, who was actually a Minister of Health, I would say, for example, I also have my background from Zimbabwe, where let's say I was there during like the 2008 cholera outbreak. You know, I have an idea of what happens during like some kind of like infectious disease outbreak, okay, and what can be required from the public, like what's the public involvement there. And so I'm not gonna lie, if I was like Minister of Health in Switzerland, yes, all of these points that you guys have brought up would be like priority list things, but like a personal worry would be like, how am I going to convince this population to adhere to these like restrictions that I need to go in place? We know they need to go in place.
You know they'll be in the streets.
Liberté, you out. What?
Huh?
To wear
a masque. T'es sérieux? Are you serious?
God, they will say you need to inject what
into my body?
They say a curfew for what? Exactly. So I think because I know how the population over here can be, there's not the same like let's say like people here are not as used to, you know, having to sacrifice certain liberties during like a public health emergency, like an infectious disease outbreak. That would be my top concern of like, this is new for people. They may not be as responsive as you would want in a pandemic. So I would be worried about like, okay, how am I going to get my public to like align with what we need them to do?
That's a very good point. I think also a lot of these countries, they did underestimate it a lot. They said, oh no, like it's just a little infection, we're above this, we're Europe. So to really, we have the capacity. Well, the capacity was tested, but definitely convincing the population like, oh no, this can get you too, like you need to comply.
Exactly.
I mean, and it's been difficult.
It's interesting how our responses are different, like because we know, I think when it comes to pandemic response and preparedness, you need to understand your population as well.
100%.
Each country has a different population. You need to know the history of the population as well, how they've handled previous pandemics and how the public has responded. Because Switzerland, people, they don't take restrictions.
Please, why are you coming for Switzerland so much? You know, the UK has been doing the same.
You don't take. I'm talking about Switzerland in particular because I see people protesting against restrictions.
UK too, America.
I'm thinking of Switzerland because I saw it live. I saw it happening.
I went to one.
In somewhere like Cameroon, like people are actually surprisingly, they don't mind taking the vaccine. They don't mind like was complying to.
No, when I went to Ethiopia, that is the most compliance I saw. Like that is the most mask wearing that I saw.
Honestly, even like right now, as we're talking, okay, this is like March 2022, right? A lot of places in Europe are now like relaxing restrictions a lot. But my dad was just like in Zim right now, and he's saying it is still masks everywhere. You cannot go if you don't have a mask. They're not, you know, compromising with you. They're like, you can't come in. Sanitizer everywhere. It is still happening. They're still on that like high level, like. You know,
and I think it's because these countries know how to deal with infections properly, like infectious diseases. They understand the gravity.
It is understood, but like Jocelyn, like you're saying, you need to pandemic preparedness. There's no one formula. There's no one template every country in the world can follow. It needs to be, adapted to the context, to your country, and to
and the population.
The population.
Exactly.
And your history,
your history. But overall, I would say like in terms of like, we understand that it can be hard to just prepare for a pandemic because like we said, on a personal level, there's things that are just so out of your control. But on a government level, they have to consider all these different things, like how are we best going to coordinate, like laws are brought up with the social security, like so that we minimize economic impacts for people. What sort of policies or like restrictions are we going to introduce that are, best suited to actually address the disease that we're dealing with here, like you brought up, Jocelyn. There's going to be research and development required because it's like it's a new thing. We don't understand it completely. We need to be able to know how best to respond and understand the virus a bit more. We need to start thinking about treatments. We need to start thinking about a vaccine. So there's all of that needs to be prioritized. And then the last thing, and I feel is usually pushed to the bottom, is the community engagement, like the public engagement. Actually, make sure that your public will be ready to receive these restrictions. You're communicating with them effectively about like, this is the virus, this is what happens, this is what you need to do, these are the symptoms, there's that whole like, health promotion side of it that's also going on. So it's a lot that goes on into preparing for a pandemic and to actually enforce it and stuff like that.
It's true.
And to
just the financing of it all as well. Where's the money? The money for the PPE, the money for everything.
And that was a big challenge at first. Remember, because there were mask shortages. So we were being told, actually, don't buy masks because the hospitals need them.
Yeah.
So because there was no financing at the beginning. So it's
and just to
if you don't
jump back on your point about community engagement.
Yes.
And I said this in one previous episode, and I'll say it again. It's very, very important that the public is involved at every single stage of the pandemic. From the moment we hear about the first case, what's the best way to involve the public, to communicate it with? How are they going to receive it? Because public fear, because I remember with COVID, there were so many misconceptions from the very beginning, which caused all types of conspiracy theories. People didn't want to wear their masks, people didn't want to self-isolate. People did not want to self-isolate at all, because initially it was 2 weeks, then it was a month, then it was a long time, and you gave people false hope. And you gave people, you got people looking forward to something, and then guidelines changed eventually. So you have to be very honest about, okay, from the get-go, this is what we're currently dealing with. Things may change, this is what may happen, but don't tell people that you're going to be out in 2 weeks and then do eat out to help out, and then come back and
tell them.
And impose a social distance lockdown in the middle of Christmas. It doesn't make any sense. Like, that's why there was so much public mistrust with the government.
No, can you blame people for having trust issues? Because, promises were being made. And I think one thing is, when you really engage with the public, like, explain, this is an unpredictable virus. This is what we're doing. This is why we're doing it. But if you're saying, oh, okay, I'm going to put you on lockdown for 3 weeks, but then after that, you'll have a Christmas. And then on Christmas, it's like, no, that's canceled. After that, we're going to do this. And it continues. I mean, I was losing my mind last year because I didn't even know what direction we were going to go.
Exactly. Because I even took this poll back on, I did like a small poll on Instagram where I asked people what they think, why they wouldn't take their vaccine and stuff. And they said the scientists and the government don't seem like they know what they're doing.
And it looks like it.
Quite a few people said that. And I said, you see, that's what they don't trust you.
I think, and if you really track what was being communicated to people, it really does look like they don't know what they're doing.
Yeah.
That's what we're conflicting each other. Sorry.
I think we always come back to this point, and we have in various episodes of, like, let's say for us, we come from the science background, we can see these things happening, and we'd be able to almost understand the side of the scientists where there's like a lot of uncertainty. They cannot communicate everything with such certainty of like, 2 weeks lockdown, we're gonna prevent 1,000 deaths for sure. That's just not how science works.
No.
To the core, it's not just about the viruses, it's not just about public, it's just science in general.
Yeah.
And so we may be able to understand that, but it's like, do the people in your government who make decisions understand that? Can you break it down to them effectively? How are they then going to take that information? Sometimes they may hear you, they'll take the information, but they will not use it at all, as we see. So again, you will also see that on the public side, there'll be this disconnect between, okay, the scientists are saying this, the government is now saying this. Last week they were saying, last
week they said this, next week they're saying this.
Yeah.
Why should I listen to them? Let me just do my own thing.
Why should I listen to them? So I think it goes back to an issue of like, this is work that needs to go into before a pandemic happens, which is gaining trust from your public. And that just doesn't come from, suddenly telling, I don't know, like,
and that's why we understand that science doesn't have all the answers. But the key is, like, even in communication, like when you're communicating with people, you need to tell them what's happening, even if you don't know. It's okay to say we don't know. Currently, we don't know, but this is what we're doing, and say it without using the big buzzwords, explain it in the language of a 5-year-old and say, this is what we're currently doing. We're currently replicating this DNA and this and that. Explain the protein stuff, all the stuff that you're currently doing, and say that this is why we have this vaccine. I'm going to vaccine and stuff again. But that's why there was so much mistrust, because people thought they understood, lay people thought they understood the science better than the scientists.
How it was being relayed to them.
100%. We cannot even continue to stress this point even more. But I guess just to wrap up, in terms of like, yes, there's the side of like the government and what the government can do to prepare, but there's also, let us not forget, our global international overviewers, the World Health Organization.
WHO.
Our favorite.
Our favorites.
I just wonder, like, okay, if you even again take yourself back to early pandemic days, like, I personally, I'm not gonna lie, was expecting WHO to be like on it, to be like heavily involved. I said, finally, the WHO that I've been interested in can get its time to shine. I know this is what the WHO has been created for, and for years when we don't have pandemics or we don't have diseases that affect like European countries, they're not taken as seriously. But now I'm like, finally, the WHO can be spotlighted. Everything that they're always saying at these meetings can finally be proven correct. So I had that expectation for WHO. I don't know if you guys, what expectations did you have for them? Like what their role would be in this pandemic?
I'm not gonna lie, I matched their energy at the beginning. When I say I matched their energy, I initially, when they didn't say anything, I thought, there's nothing. The moment Tedros said public health emergency, this is it. So that's how the WHO has so much impact. They give guidelines, but when you hear the WHO has declared that this is a public health emergency, everybody was like, quick, let's do. You hear this left and right. So I think I'm gonna start off on a positive note. I'm gonna start positive because with the H1N1 pandemic, the response was a lot slower. I think it started off around, was it 2009? The H1N1. 2009.
I was a child, I don't know.
They started off, I think it started off around same time, November, December. But the reporting actually happened months later. Months and months later. The WHO didn't even notify the first case months later. The first notification in this pandemic was a week later. So I mean, once we can bash them and say, they were not quick enough. They took some time because they underestimated it. But I think in comparison to a previous pandemic that happened, they did learn a little.
There's improvement.
A little bit.
Yeah, I think we see the WHO as like this very powerful, global health institution, but like what's important to remember is the WHO is only as powerful or as strong as the member countries will allow it to be. So if member countries are not cooperating, the WHO can only do so much. They're sovereign. So even in terms of declaring, some people say, why did they wait so long to declare the pandemic? There are certain definitions that it has to fulfill for it to be called a pandemic. You can't just call it a pandemic if it affects 5 countries. They say, why didn't they act sooner? Why didn't they do this? But do we not remember the US was trying to pull out of the WHO last year because of how they were addressing the pandemic, because they claimed the US was too nice to China. The WHO was too nice to China. So it's like countries also tried to impose their political beliefs on the organization. And the organization relies on funding from said countries. Like the US is one of the biggest funders. If the US goes, the WHO goes. You get what I mean? So it's only as powerful as these big countries are. So I didn't think they would shine too much if the countries didn't let them shine.
100%. I agree. I think the WHO and even Tedros himself. I say Tedros like he's my friend.
I know. Hey,
Dr. Tedros Adhanom, man. Put some respect on his name.
Say the full name. Put some respect.
I'm done. But I felt bad for him.
It can be a difficult position to be in, exactly for the points that you guys made. Because let us not forget, me, if I was China already, I would be shaking in my boots. If I detected, I'm not saying personally, if I was in China, I'm not saying this is what China did. I'll say personally, if I was in China, if I detected some new infectious disease or something, obviously I'm shaking my boots because I'm also considering the economic impact.
Absolutely.
Money talks. I'm like, if I suddenly announce that I have another outbreak or something, because China had SARS before, they also had MERS, and that had huge impact on their tourism as well.
Yeah, they're probably like, oh no, not again.
So not again. We don't want this to happen again. So obviously, maybe.
And at the time, Trump was calling it Wuhan. Trump was not helping.
Oh,
No,
yeah,
Trump
The
was not.
Wuhan virus.
Trump was calling it the China virus.
At the level of, I've just detected something.
Yeah, like this is
The
before
time
Trump
I'm
knew.
now like, okay, let me just go up and face my fronts. I'll go and I'll tell WHO, I'll go and I'll announce, and then, you know, WHO then also has to look at it and be like, okay, now what's going on in this situation? They have to do their own investigations, Now, if USA is also over here with their own political agenda and they're hearing of these whispers of some new infectious disease, they're like, what's going on there? What's going on? What's going on there? You say China what? Wuhan what? Wuhan virus? There were so many countries
that the US tried to they sent some scientists in China, and the Chinese, they came and created the virus from the bats, and then the bats,
it was a lot to do with. It was a lot to do with. And I think I agree with you, Jocelyn. Like when we actually compare like the WHO response,
yes,
like from historic times, like even with Ebola and how quickly they respond in terms of saying like declaring that this is a public health threat and being like, no, we're actually escalating it to what? This is a pandemic now. I think they were much faster this time.
They were much, that we can complain. But you know, did they learn? They've learned from the previous one. Did they make the same mistake? They made a few mistakes here and there. But you know, we can't bash, not everyday bashing now. Let's also appreciate.
Yeah. But we should still balance it. It's like, is there anything we do wish the WHO would have, you know, done a little bit more? Is there any other area we feel like they should have shined a little bit more?
Shined a little bit more. I mean, what can they do? First of all, they don't have any binding treaties at the moment to like regulate countries' responses, right, to pandemics. So for me, like, I would have loved for the WHO to have the power to regulate countries' responses to the pandemic. So if that is shutting borders, you know, they announce, okay, if this criteria is met, this is how you should respond. If it's testing, if this criteria is met, this is how you should respond. In terms of diagnostics, sharing diagnostics, PPE, vaccines, you know, actually putting binding laws so that countries would actually properly be coordinated and accountable. Like coordinated actions and accountability, because what we saw during this pandemic, what was frustrating for me was one country over here would be doing one thing and the other one would be doing the opposite, and they would all be going in different like directions. They would be reacting. They would not be necessarily trying to prevent. It would be, you know, new variant comes, they react, they all close their borders. It's too late. I know
South African variant.
Even the Delta variant. Like, I mean, it's like they even repeat the same mistake. So for me, just having like binding laws that hold countries accountable so that they have coordinated responses, that would have been ideal. But at the moment that we were talking in 2020, the WHO did not have that power. So
the WHO was just providing guidelines, and that's all
they say, oh, please do this, please don't do this, but countries can say no thanks.
That's what I mean when I say, for me, I had that expectation of the WHO early on in the pandemic to be able to like step up and be that person, because I feel like that is really key to their role. As similar to other UN agencies like International Labour Organization, WHO, you know, I think the treaty around like tobacco, like that's the only treaty we have. Loza, I think you're the one who knows more.
Yeah, and then IHR, which is like the International Health something, but we
don't have that many treaties because it is very hard to get them and to, you know, get countries to actually sign them. But I feel the people who need to put the energy into that is something like the WHO.
Right.
Yeah.
I feel like that should have been early on, like considered.
100%.
Yeah, but then at the time, my countries were doing completely different things.
That was the problem, and that's why I think. And
it goes both ways though, because the WHO can't do anything unless the countries agree. Like they're the ones that vote. You get. I mean, now they've learned.
Yeah,
and they're trying to do a pandemic
when the US was giving the WHO attitude.
God, the US was trying to leave even. I'm sure they were shaking in their boots.
There was a lot happening at the same time, and then there was the let me not go into that. Let me just don't mind me.
No.
Yeah. I mean, to be fair, actually, it's like, we actually don't know what was going on at the back. They could have been pushing efforts like this for like 2 years or whatever, and it's only now we're getting an announcement of like.
And I mean, there were like people that suggested way back, after Ebola. We should probably fix some of these WHO things, give it a bit more power to hold countries accountable in case there's another outbreak. And countries were like, no, thank you.
That's okay.
We're good.
And we know the bureaucracy that goes into like global health and public health, particularly emergencies. To act fast, that leads me to my next point. To act fast in a pandemic is something that needs preparedness.
Yeah.
Preparedness, particularly when it comes to like standard operating procedures, SOPs, when it comes to pandemic preparedness. I don't think that is not the WHO's responsibility, but I don't think a lot of countries had that. So in this particular scenario, it was almost like they were just reacting.
Yeah, it was too late.
If there was some kind of standardized procedure, okay, this is what happens, and then do this, and then we notify. I mean, they notified, and then countries. Then we advise the high-income countries. Then we advise the low-income. Then we say this. Then we say that. A clear plan. There was no clear plan, and we saw what happened. So.
Yeah, exactly. It was too late. By the time COVID came, it was too late to be doing, let's prepare. Yeah, you're not prepared.
Yeah, exactly. If you're not prepared, you're just not prepared. I mean, in the interest of time, like, okay, I'll quickly mention, for example, South Korea. That was a country that was, we saw early on in the pandemic, they were very responsive and people were just like clapping hands for South Korea because they were very good in terms of like controlling like at the early stages. And I think the key thing there to highlight is that it's because South Korea they put in the work to actually learn from previous experiences.
Rather than just closing their borders.
Yeah, rather than just closing their borders, but just explain the context.
Come and see shade. Come and see shade.
Come and see shade, yeah. So they had like, for example, a MERS outbreak in 2015 and like not handled as best as they could do, for example. And I mean, I have some statistics here, but no need to get into it. Spill the tea. Okay, spill the statistics. All right. So, for example, like the MERS outbreak there in 2015, it resulted in like 17,000 suspected cases, and there were like 38 deaths. So it doesn't seem like much, but then over like the 6 months where that pandemic took place, the South Korean government lost an estimated like 2.6 billion in tourism revenue. And they spent like almost $1 billion on diagnosis, treatment, and other parts of their response. So what I liked is, as I was reading about South Korea, is that 2015, after that MERS outbreak happened, they set out these 48 reforms, and I can provide a link to where they are. They're quite interesting read, but they set out these 48 reforms of like, okay, this is what we need to do to prepare, and some of the stuff included like, okay, we need more infection control staff and isolation units. We need to expand our outbreak simulations and PPE training. We need to have better collaboration between like medical centers and local governments. They set this out. They're like, oh, this is what needs to be done, and then they actually did it, y'all. They actually did it, and then guess what? By time COVID came, they were prepared.
Come and see applying it.
So I think, like Justin, you're saying now with like the travel bans. So again, because for example, obviously when cases were first reported from Wuhan, some countries, the first response is, travel ban. We need to ban anyone coming in from Wuhan, anyone coming in from China. That's not even the approach that South Korea took. South Korea aligned with what WHO had always like recommended, which was, you track these people, you check them at the border, you get them to self-isolate, but there's no need to actually impose a travel ban. And that was what South Korea implemented. And they were still able to control the epidemic, the outbreak pretty well early on in the days. So that just goes to show that it's like, you prepare, you be ready to face the next challenge. You don't need to do what everyone else was doing with these old travel bans and which in the end didn't work out that well.
And it was China did really well as well. When we heard that it started off in China, everyone was concerned. They initially started with a lot of cases, but eventually, in comparison to the United Kingdom and the US and Russia and India, I'm sorry, China did a lot better. And they started off with, quite a lot of cases, but with time, they acted quick. They acted really quick, particularly exploiting the scientific community, the scientific expertise, the healthcare professionals. Everybody came together in China, and they did it quick. And they had, I remember when it was in Wuhan, they had a lockdown in Wuhan particularly, not necessarily in the whole of
country.
China, whole country. They had local lockdowns, which was quite effective. And I think towards the end of the pandemic as well, it's not always necessary to have national lockdowns. That depends on your country, but in that case, it worked really well. So yeah, closing your borders is not always the first quick solution you have to go to.
Yeah, exactly. And so I guess now to just talk about, okay, we've already mentioned quite a number of points, but like, what can we do better in terms of pandemic preparedness? Anything else that we can do better? We've already kind of touched on, you need better coordination in terms of like how you're communicating with the public, so you just don't look like headless chickens running around.
That used to be a caption. Please repeat what you said.
Oh my goodness. Say it again.
You better prepare so you don't look like headless chickens running around.
Yeah. We need to invest a little bit more in our public engagement, like we said, to really address that mistrust. So I mean, any other additional points from you guys in terms of like, what can we do better in terms of preparedness?
I'm stressing on the SOPs.
Okay, stressing on the SOPs.
I'm stressed as high. You know how you can highlight something, underline it? Yeah. I stress on the SOPs, because when it comes to pandemic preparedness, you can come at it with 3 different approaches, right? You could have the number 1, the economic factor, like the economic impact of the pandemic on people. So that's the first thing that the government would think about, how it's going to affect the economy, particularly like providing financial incentives to vulnerable people and people from low economic groups. That's one thing. Then there is actually tracking the virus, coming up with healthcare solutions, what we need advice from, right? There's that. And then there's the actual pandemic itself, like the national guidelines and the guidelines and the restrictions and stuff like that. These are 3 different approaches. All of these come hand in hand all together. It doesn't mean that you have, just because you prioritize you want to prioritize the economy, doesn't mean that you automatically say, okay, now let us all socialize again tomorrow and then change the lockdown rules. It is counterintuitive. It is counterproductive. So I think that if there are standard operating procedures based on these 3 different aspects, and also based on control measures, factoring testing, control, implementation all together, that would be much better. I think that would make quite a significant difference in how we respond to this pandemic. I have more to add.
I like that. Yeah. No, I like that. I do. I like the idea of like things that are standard, and then you know what to do instead of again being headless chickens. I just want to highlight, like, I want us to learn from this one. Please, let's not do this again. I think we were dragging the WHO, but now they're they're meeting to propose a new treaty for pandemic preparedness. Now, I don't know what they're going to put in there, because the Russians and the Americans are fighting them. I don't know, they don't want one. But when we look at like, okay, things like that, treaties, like I would advise for like more global cooperation. And more coordination, so that like everyone is kind of going in the same direction, so that we can have the best outcome. And because this is not like I doubt this is the only spillover event that's going to happen in our life. Like there could be another, virus that jumps from an animal to us and now, threatens for another pandemic. And pandemics can be avoided if governments are working in coordination. And also, let's go back to our climate change podcast, but let me come in with a little one help, but also like respecting the environment as individuals and as government as well. Yes. So a lot of these spillover events or zoonosis, like viruses jumping from animals, it's because it occurs because we're encroaching on their habitats. We're going to places that we're not meant to be going. We are, misusing animals in different ways. So I would say, be more conscious of that. I think if we're more conscious of that, and if we really consider the environment when we talk about health, I think we can actually prevent a lot of these spillover events.
And I really like what you said. Just to add on to that, I think even now we still don't really know the origin.
No, not exactly. No.
And there's been hypotheses and predictions that there's been crossover events between bats and different
fish markets
and stuff. But it just goes to show that there needs to be some form of, I don't know, like they just need to understand that respect the environment and also proper hygiene. And I know I'm sure
sanitation.
But I think I had a point earlier which I forgot. Now, countries. Now I'm talking to countries. I'm not talking to the WHO. I'm talking to countries. Okay.
Yeah. Tell them.
The healthcare sector is critical.
Yeah.
I know that a lot of countries have not put I think the healthcare sector in a lot of countries is still not classified as a critical sector. Now, I'm pretty sure by now you know it is critical. I don't understand why you'd have so much finance, you'd have so much money and finances going into weapons for war when the virus is coming for you. The viruses don't decide. The viruses don't have any bias. They'll come for your country either way, like whether you like it or not. So you might as well be prepared. So I strongly also think that the healthcare sector needs more investment for better pandemic preparedness and make sure that it is classified as a critical sector and take it, a little bit more seriously.
Yeah, prioritize health. I mean, no, after this, if they haven't learned, I don't know.
Because I know that, a country like France, they prioritize a lot. They have a lot going on in terms of preparedness for terrorism.
And health?
Where was money for PPE?
Where was money for PPE?
No, guys, no. I literally just remember reading this story about, remember when countries even in Europe were scrambling for PPE?
Yeah, they were fighting each other, man.
France, I swear there was a story where allegedly they tried to block this shipment that was going from Turkey and then was going to pass through France and go to another country. And the shipment had PPE. They allegedly tried to stop this.
Mate, it was getting embarrassing.
It was getting bad, yo. Bad.
It's so bad. I remember.
So the terrorism money is there, but when it's money for PPE,
please, the virus could be a terrorist too.
As you said, Bill Gates did say that we're more likely to have a pandemic with an airborne virus than a war, right?
To kill
10 million, we got it.
10 million people. Yeah, he was right.
Oh,
and next time, we don't know if the pandemic is if there's going to be a pandemic that will be a respiratory. It could be oral to fecal infection. It could be anything else. So be ready. Stay ready.
Now, next time if there's a pandemic, they're gonna blame you. They're gonna say, "See, she made it. She designed it." If it's fecal transmission, they'll say Jocelyn.
I mean, there's already I heard there were 2 cases of Lassa fever in the UK not long ago. So I'm not saying it's gonna happen. But,
stay safe, yo.
I mean, listen, with climate change and the mosquitoes moving, I mean,
it is at your doorsteps. I did say that.
Our doorsteps, yeah. And then like Jocelyn, like you mentioned that what were you saying about wash?
Sanitation.
There we go. Wash your hands, not just wash your hands, but very, very in terms of the in the lab, they're very, very, very sanitary hand sanitizers, but also making sure that the equipment are properly cleaned with ethanol, all the equipment that is needed, properly ambushed for this.
She said, don't let this happen again.
Wash techniques are very important especially when it comes to decontaminating food products, decontaminating the water, decontaminating different systems that we use for nutrition and stuff like that. So
great point again. Sometimes it's really down to basics. It
really is. The sanitation, like the things it can achieve, it really comes back to it.
And then for me, just on the last point, it's like obviously a lot of pandemic preparedness, like we said from the beginning, is not on you as a person to figure it out. WHO cannot figure it out. Our own governments they cannot figure it out. But I just came across some of these cool apps that I saw because in the interest of public engagement with science and getting people, like if you actually want to get more involved with the science, there are, for example, these apps where you can almost help provide data that can then go into tracking diseases, tracking pandemics and all that kind of stuff. So the example is this Israeli initiative related to COVID, where they had people fill out these like daily forms, like that literally took 1 minute. And then the data they collected from that would actually help them like predict and locate any like COVID hotspots. So that was already one way that you as a person could like contribute, you know what I mean? Like you can actually help them identify hotspots. And then overall, when it comes to like other, you know, epidemics, like flu, influenza, there are countries like Australia and New Zealand that have these like flu tracking apps and surveillance systems where people
see digital health.
Go in and input like some data, and then, you know, that's how you'll be helping like even your government, you know, track and like report cases and all these different things. So it's also investing in these early warning systems, you know, that could then help even the governments in the future. So with that, do you guys have any more takeaways, any last messages, any burning?
Actually, I do have something to say to my globies.
Tell them, tell them.
Let's be kind to each other in the pandemic. This is very basic. Let's be human. You know, I've atted the scientists enough. I've atted the countries, atted the government. But, you know, as people, there's no point of blaming other people, blaming the non-mask, or saying, oh, I won't wear my mask, oh, I will wear my mask, or I won't do this. I think being kinder in a community and also offering support. I know there were people that were volunteering to give food, to do groceries for people that were self-isolating. That was a good deed. So if you want to, you know, help out where you can, you know, we're also loving people. Just to leave it on a positive note.
Much nicer note. We love that. We love that.
Wholesome.
So wholesome. Well, otherwise, this has been the World Health Investigation Podcast. I'm Edna.
I'm Jocelyn.
And I'm Loza.
We are 3 young global health professionals and your hosts for the World Health Investigation Podcast. Jocelyn, you're excellent at all of our social plugs.
Please plug.
Please.
Follow us
okay.
on Instagram at WHO.
Not that one. I mean, follow them if you want, but no.
Too much in this podcast.
Exactly.
Come see free promotion.
Right? Anyways, please follow us on Instagram at WHI_podcast, on Twitter at WHI_podcast. We also have a Facebook and LinkedIn account at World Health Investigation. And please subscribe to our YouTube channel.
Period.
Subscribe. Like, it's so easy. It's very easy. You're really watching it.
Also, like the WhatsApp, everything. Just follow us everywhere.
And follow us.
Whatever you have, open it and just follow us.
Follow us. It takes us like, please, we're trying our best. Just three young girls trying, you know? Just some support. But it's not paying you. It's less than $1. It's $0.
It costs you $0 to support me. To support us.
Support us. Go support us right now.
Loza, why are you cringing?
We're begging. I said, ew, you don't have to. You don't want to.
No. Like, please. Don't listen to her. Don't that energy. We are humble. Please. Yes, we're begging. We are actually begging. I am begging with my chest. Right. And you get the message now. Thank you very much and have a lovely rest of the week.